Hey guys, my name is Dr. Alex Tatum, and I'm a fellowship-trained urologist specializing in male, sexual, and reproductive medicine. This video is part 2 of our 2-part series talking about UroPlan. UroPlan is Urology of Indiana's new prostate and bladder cancer survivorship program, and today we're going to talk about our 2 restoration roadmaps and each of their steps in detail. So join us for The Man Cave, Season 1, Episode 6. So if you haven't had the chance, I would strongly encourage you to watch our previous video, where we talk about the challenges that men undergoing prostate and bladder removal face, and how rehabilitation is designed to help overcome these. Now today is going to be a deep dive on UroPlan's 2 distinct treatment and recovery plans that we call our restoration roadmaps. These 2 plans are known as our active roadmap and our passive roadmap. Let's talk about our active roadmap first. Our active roadmap has been designed using the maximum effort, tools, and medications available to help optimize men's recovery following pelvic surgery. Using the latest clinical research, the active roadmap helps men regain their best possible quality of life in regards to both their urinary and sexual function. Men are provided with detailed instructions on each of the topics we're about to discuss, and get the chance to discuss these with our men's health team prior to their planned surgery. The active restoration roadmap has 3 key steps that we call the 3 Ps. These are preserve, perform, and prevail. Our first P, preserve, encompasses the 4 key interventions that we use to help maintain the health of the erectile tissue while the pelvic nerves are still recovering, and also strengthen the pelvic floor muscles that are responsible for bladder control. These include, number 1, a daily dose of the pro-erectile medication Tadalafil, also known as Cialis. Number 2, twice daily supplementation with the vitamin L-CITRULLINE. Number 3, daily penile exercise with a tool known as the vacuum erection device, or VED. And number 4, daily Kegel exercises to strengthen the pelvic floor muscles that control the bladder. Let's talk about the 2 oral medications, Tadalafil and L-CITRULLINE. Tadalafil was first introduced to the US market in 2003 as Cialis, and at the time was only the 3rd oral medication available for the treatment of erectile dysfunction. However, unlike other short-acting medications such as Sildenafil, also known as Viagra, and Vardenafil, also known as Levitra, Tadalafil was found to last a long time in the bloodstream, up to 36 hours. This makes it an excellent choice as a low-dose daily option for men looking to improve penile blood flow. Although Tadalafil was originally conceived as a treatment for mild vascular erectile dysfunction, we use it in the context of rehabilitation to improve baseline blood flow to the penile tissue. While it won't give most men spontaneous erections immediately following surgery, we know that it improves baseline blood flow that is so important for keeping erectile tissue healthy as the pelvic nerves recover. The same is true for our second oral medication, L-CITRULLINE. L-CITRULLINE is actually a type of supplement known as an amino acid that you can buy over the counter or online. We recommend a dose of at least 1,500 milligrams twice daily. It is absorbed by the bloodstream and then goes through a series of chemical changes that ultimately improves the production of nitric oxide in penile tissue. Nitric oxide helps contribute to the same reaction that Tadalafil is promoting. When taken together, these 2 medications help improve penile blood flow significantly. Now, men who are taking nitrate medications for their heart should tell their doctor and not take Tadalafil. When combined with nitrates, like under-the-tongue nitroglycerin tablets or the blood pressure medication isosorbide mononitrate, Tadalafil can cause an unsafe drop in blood pressure. Now let's talk about the vacuum erection device, also known as a VED. Although oral medications are great, men do their best when using multiple approaches to improve penile blood flow. Oral medications do this chemically, but the vacuum device does this manually. It works like this. The VED is an external pump that's attached to a hollow tube. By creating a seal with the skin around the penis, the VED pump removes air from the cylinder and pulls blood into the erectile cylinders. This forces blood into the erectile tissues of the penis, helping deliver oxygen where it's needed most. At the same time, it stretches the penis and helps prevent some of the penile length and girth loss many men experience following pelvic surgery. That's why the VED is so important and considered to be an essential part of rehabilitation. We recommend using the vacuum device daily with a protocol that's available in our handout. Each of the UroPlan handouts are available on our website at www.indymenshealth.com, and through the links in the description down below. Now, men who are on certain blood thinners, like Plavix, also known as clopidogrel, and Coumadin, also known as warfarin, may not be able to use the VED because of the risk of bruising. Those men may benefit, however, from a different type of device, known as a traction device. Traction devices gently pull and stretch the penis, which can help prevent penile shortening if a vacuum erection device is not an option. Some examples of penile traction devices include the RestoreX and the Penemaster Pro. More information regarding these devices can be found in our handout. So those are our strategies for preserving erectile function after pelvic surgery. To recap, men should take a daily dose of Tadalafil, a twice daily dose of L-CITRULLINE, and use their vacuum erection device daily. And men should start doing this 2 weeks before surgery. The sooner men start, the better. And starting before surgery allows men to get comfortable and establish a routine before dealing with the stress of surgery itself. If a man is having his prostate removed, we recommend restarting the vacuum device exercises as soon as the catheter is removed. These medications and exercises are maintained throughout the recovery period. But what about bladder and urine control? Although all men will leak a little bit of urine immediately following prostate removal, early exercise can help strengthen these muscles and allow men to hold their urine more effectively sooner. The ideal exercises that can help with the recovery of urine control are known as Kegel exercises. These are a type of pelvic contraction that work the sphincter and other pelvic muscles that assist with bladder control. Think about pinching off your urine stream as you're urinating. This is the same sort of contraction that is performed with a Kegel exercise. We recommend that men follow the exercise regimen detailed in our handout, and, as with our erectile preservation exercises, start 2 weeks prior to surgery. So that takes care of everything for our first P, preserve. But what if a man wants to perform sexually before the recovery period of his pelvic nerves is complete? And what if he wants to achieve better urine control even faster than what Kegels alone can provide? That's where we get into our second P, which is perform. Perform encompasses everything men can do to help achieve functional erections while still in their recovery period, in addition to advanced exercises to help improve urine control. Let's talk about the strategies that men can use for achieving erections. There are 3. Number 1, an as-needed dose of the medication Sildenafil, also known as Viagra. Number 2, penile injection therapy. And number 3, using the VED for sex as opposed to just penile exercise. So, what is Sildenafil, also known as Viagra? Like the daily Tadalafil that we mentioned earlier, Sildenafil is an oral medication designed to treat erectile dysfunction by improving penile blood flow. However, unlike the daily Tadalafil, Sildenafil is short-acting and meant to be taken on an as-needed basis. Men should take their as-needed dose of Sildenafil about an hour before sex and on an empty stomach. This is in addition to the daily dose of Tadalafil that men should already be taking. This double dose approach can help many men achieve functional erections even as they continue to recover from pelvic surgery. We typically prescribe the 100 mg dose of Sildenafil and recommend that men start with a half tablet. If this doesn't work, the dose can then be increased to a full tablet. Like Tadalafil, Sildenafil cannot be combined with nitrate medications. Common side effects include stuffy nose and headache, but not all men will experience these. Now, what if the as-needed dose of Sildenafil doesn't work as intended? That's where intracavernosal injection therapy comes into play. So what are penile injections? Also known as intracavernosal injections, imagine taking a medication similar to Sildenafil or Tadalafil and dissolving it into sterile water. This solution can then be drawn up with a small needle and injected directly into the side of the penis into the erectile bodies themselves. This allows men to achieve a higher dose of medication right where they need it. These types of medications have different names based on their relative ingredients and strengths. Some examples include bimix, trimix, and quadmix. Each of these medications are much more potent than oral Tadalafil and Sildenafil, and most men can achieve a functional erection with them. It's just a matter of finding the right medication and dose. That being said, even if men start to use injections for their erections, they should still continue to take their daily doses of Tadalafil and L-CITRULLINE, in addition to performing their daily penile vacuum exercises. Although effective, penile injections do have some challenges that men should be aware of. The medication itself needs to be kept in the refrigerator, which can make spontaneity a challenge. Also, the injections and the resulting erections can sometimes be uncomfortable, depending on the medication being used. Men also need to be careful about taking too much medication, as this can result in a painful erection that won't go down on its own. Although rare, this is known as a priapism and requires urgent medical attention. These are just some reasons why penile injections can be a challenge for some men if used long term. That being said, they can be a great short-term solution for men as they continue to recover from pelvic surgery. Lastly, for men who don't respond to the extra dose of oral sildenafil and either don't want to or are unable to use penile injection therapy, the VED itself can be used to achieve erections suitable for sex. It works like this. First, the VED is used to create an erection. Then, a constriction band is slid onto the base of the penis to maintain that erection so it can be used for sex. It's important to note that since the constriction band completely obstructs blood flow, it can only be used for 30 minutes at a time. Still, this can be a good option for men when other approaches are ineffective. Now, what about the additional exercises that men can use to improve bladder and urine control? If men are still leaking urine at the time of their 3-month follow-up visit, we will often recommend pelvic floor physical therapy. Pelvic floor physical therapy offers men the chance to practice advanced pelvic exercises beyond just Kegels. These can offer men the chance to achieve even greater control over their urine stream. So that's everything for our second P, perform, and brings us to our final P, which is Prevail. Prevail is the final step of the UroPlan Active Restoration Roadmap and discusses the options available to men to regain their sexual and urinary function if they still haven't achieved the function they desire at the end of their recovery period. We know that no rehabilitation program can guarantee 100% success, and that a man's recovery is highly dependent on his preoperative erectile function, his own anatomy, and the nature of both his cancer and surgery. However, every man deserves the chance to have full sexual function and bladder and urinary control. Let's talk about the options that we have to restore erectile function. Fortunately, each of the options that we discussed in the Preserve and Perform sections of the roadmap can be used to achieve erections even if no further recovery is anticipated. Men can still use a combination of Tadalafil and Sildenafil, use penile injections, or even use the vacuum device to achieve erections. But that being said, we recognize that many of these options have significant drawbacks that prevent them from being viable long-term options for men. Luckily, for men that are motivated and desire a definitive cure for their erectile dysfunction, we have a solution in the form of the penile implant. The penile implant is a safe, invisible, and reliable cure for erectile dysfunction that is placed during a minimally invasive outpatient procedure. It is completely hidden and allows men to achieve a firm, natural feeling, and natural appearing erection on demand. It works like this. As we've mentioned many times on this channel, the male erection is essentially 2 inflatable tubes that start in the pelvis and extend out the shaft of the penis. These tubes don't control sensation, ejaculation, or orgasm, just erection. With the penile implant, we essentially say this: hey, since these inflatable tubes aren't working the way we need them to, let's just slide our own inflatable tubes inside the body's natural ones. Then, instead of having to rely on a pill or a shot, men can achieve an erection whenever they want by squeezing a small pump hidden under the skin. This then fills the new cylinders with saline, just like the body used to fill those cylinders with blood. This creates a firm erection that lasts as long as a man desires. Then, when he's finished with sex, all he has to do is press a small button on the top of the pump, which allows the penis to return to the flaccid state. This is all placed through a small opening in the skin, less than 3 inches in size, during an outpatient procedure that only takes a little over half an hour. Men go home the same day, with the vast majority of them resuming normal activity in a day or two and resuming sex in about 3 weeks. I want to emphasize that our #1 goal with rehabilitation is always for men to regain their natural erectile function. But for those men who don't, the penile implant is considered to be the gold standard cure and has better reliability and satisfaction than any other treatment. But what about bladder and urine control? Although most men will regain their bladder and urine control with time and exercise, some men may still experience some urinary leakage after their recovery period is complete. For those men, coping mechanisms such as adult diapers or pads should never have to be accepted as long-term solutions. Fortunately, men have 2 fantastic and durable options for restoring urinary and bladder control: the Male Sling and the artificial urinary sphincter. So what is a Male Sling? The Male Sling is a thin piece of mesh that is placed to elevate and compress a man's urethra, which is the urine tube that urine passes through during urination. By elevating and compressing the urethra, the Male Sling gives a man's natural sphincter extra support and allows him to control his urine stream with less effort. This is placed through a hidden opening in the skin behind the scrotum in a minimally invasive same-day procedure. The Male Sling has been optimized for men suffering from mild to moderate urinary leakage who can still start and stop their urine stream while urinating. It is also a fantastic option for men that are bothered by climacturia, which is the leakage of urine with orgasm after prostate removal. Now, what is an artificial urinary sphincter, also known as an AUS? The AUS is an implanted device that duplicates what a man's natural sphincter does, which is pinch off the urine stream. This is accomplished by a small balloon that is wrapped around the urethra in order to gently squeeze it shut, preventing unwanted leakage. When a man's bladder is full, he activates a small button under the skin in the scrotum. This relaxes the balloon and allows his bladder to empty. Much like the Male Sling, the artificial urinary sphincter is placed during a same-day, minimally invasive outpatient procedure. The decision to proceed with either the Male Sling or AUS placement is very individualized and based on the type and degree of a man's urinary leakage. Neither is better or best, they're simply designed with different patients in mind. So that's everything for the UroPlan Active Restoration Roadmap. To recap, we have the 3 Ps: preserve, perform, and prevail. Each step has been designed to give men their best chance at regaining normal sexual and urinary function. But what about men who aren't able to stick with the active restoration roadmap? Fortunately, for these men, we have a separate and distinct pathway that we call the passive restoration roadmap. In our passive restoration roadmap, men are not required to have a preoperative appointment with our Men's Health Center team. Instead, they are provided with a prescription for a daily dose of Tadalafil and instructions on how to perform daily Kegel exercises. These are started prior to surgery and continued afterwards until their postoperative appointment with our Men's Health team. Then, just like with our active roadmap, a custom recovery and treatment plan is devised to fit each man's unique needs and goals. So that's it. That's the UroPlan Pelvic Surgery Recovery and Rehabilitation Program. I hope these videos have been helpful. If you want to learn more, check out the handouts in the description down below. And check out our website, along with some of the other videos on this channel. If you like these videos, hit that like button and subscribe. It really helps the channel out. Until next time, this is Dr. Alex Tatum, signing off.